Understanding drug addiction, definition and scope. Drug addiction, also known as substance use disorder, is a chronic, relapsing brain disease characterized by compulsive drug seeking and use, despite harmful consequences. It is not merely a lack of willpower or a moral failing, but a complex condition that profoundly alters brain function and behavior over time. This disease affects millions worldwide, transcending socioeconomic status, race, and gender. Understanding addiction as a medical condition is crucial for effective treatment and reducing societal stigma. It involves significant changes in the brain's reward, motivation, memory, and related circuitry. Recognizing its chronic nature helps in approaching recovery as a long-term process rather than a one-time event. Ultimately, with appropriate treatment and support, recovery from drug addiction is entirely possible. The scope of drug addiction encompasses a wide range of substances, from illicit drugs like heroin and cocaine to prescription medications such as opioids and benzodiazepines, and even legal substances like alcohol and nicotine. Each substance carries its own unique risks, mechanisms of action, and withdrawal profiles. The severity of addiction can vary greatly, from mild to severe, depending on the substance, frequency of use, and individual vulnerabilities. It often leads to significant impairment in health, social functioning, and occupational responsibilities. Addressing this widespread issue requires a multifaceted approach, integrating medical, psychological, and social interventions. Early intervention and comprehensive care are key to mitigating its devastating effects on individuals, families, and communities. Types of addictive substances, categories, and effects. Addictive substances are broadly categorized based on their effects on the central nervous system. Depressants, such as alcohol and benzodiazepines, slow down brain activity, leading to relaxation, but also impaired coordination and judgment. Stimulants, including cocaine and amphetamines, accelerate brain function, causing increased energy, alertness, and euphoria, often followed by a crash. Opioids, like heroin and prescription painkillers, relieve pain and produce intense feelings of pleasure, but carry a high risk of respiratory depression and overdose. Hallucinogens, such as LSD and psilocybin, alter perception, mood, and thought processes, often leading to distorted sensory experiences. Cannabis, while having various effects, can impair memory and coordination, and lead to psychological dependence in some individuals. The effects of these substances extend beyond immediate intoxication, impacting long-term physical and mental health. Chronic use of depressants can lead to liver damage, memory problems, and severe withdrawal. Stimulant abuse can result in cardiovascular issues, paranoia, and psychosis. Opioid dependence often leads to constipation, hormonal imbalances, and a high risk of fatal overdose. Hallucinogen use can trigger persistent perceptual disorders or exacerbate underlying mental health conditions. Understanding these specific categories and their associated risks is vital for both prevention and tailored treatment approaches. Each substance presents unique challenges in terms of addiction development, withdrawal management, and relapse prevention strategies. Neurobiology of addiction. Brain's reward system. At the core of addiction lies the brain's reward system, a network of neural pathways designed to reinforce life-sustaining behaviors like eating, drinking, and social interaction. When these natural rewards are experienced, the brain releases dopamine, a neurotransmitter associated with pleasure and motivation, creating a positive feedback loop. Addictive drugs hijack this system by causing an unnaturally potent and rapid surge of dopamine, far exceeding what natural rewards can produce. This intense rush of pleasure strongly reinforces drug-seeking behavior, making the brain prioritize drug use above all else. The brain begins to associate the drug with survival, leading to compulsive use. Over time, the brain adapts to these overwhelming dopamine surges, reducing its sensitivity to both drug-induced and natural rewards. This adaptation explains why individuals develop tolerance and often lose interest in previously enjoyable activities, as their brain's reward system becomes dysregulated. Repeated drug exposure fundamentally alters the brain's structure and function, particularly in areas responsible for decision-making, impulse control, learning, and memory. The prefrontal cortex, vital for executive functions, becomes impaired, leading to poor judgment and an inability to resist cravings. Memory circuits are strengthened, creating powerful associations between drug cues, people, places, things, and the desire to use. These changes are not temporary. They can persist long after drug use has ceased, contributing to the chronic, relapsing nature of addiction. Understanding these neurobiological changes is crucial for developing effective treatment strategies that aim to restore normal brain function and help individuals regain control over their lives. Recovery involves not only stopping drug use, but also repairing and retraining these altered brain pathways. Tolerance and physical dependence mechanisms. Tolerance is a phenomenon where a person needs increasingly larger doses of a substance to achieve the same desired effect that was once produced by smaller amounts. This occurs as the brain and body adapt to the constant presence of the drug, becoming less responsive to its effects. Cellular changes, such as a decrease in the number of receptors or a reduction in neurotransmitter production, contribute to this adaptation. For example, someone who regularly uses opioids will find that their usual dose no longer provides adequate pain relief or euphoria, necessitating higher doses. This escalating consumption significantly increases the risk of overdose and other adverse health outcomes. Tolerance is a key indicator of physiological adaptation to a substance, driving individuals to consume more, often unknowingly deepening their dependence. It highlights the body's remarkable, yet ultimately detrimental, ability to adjust to external chemical influences. Physical dependence develops when the body has adapted to the presence of a drug to such an extent that it requires the substance to function normally. If the drug is abruptly stopped or significantly reduced, the body reacts with a set of characteristic withdrawal symptoms. These symptoms can range from mild discomfort to severe, life-threatening conditions, depending on the substance and the individual's physiological state. It is crucial to understand that physical dependence is distinct from addiction. One can be physically dependent on a medication, like certain blood pressure drugs, without being addicted. However, in the context of illicit drug use, physical dependence often co-occurs with addiction, making cessation extremely challenging due to the intense discomfort and danger of withdrawal. Managing physical dependence safely often requires medical intervention. Withdrawal syndrome, symptoms and management. Withdrawal syndrome is a cluster of physical and psychological symptoms that occur when a person who is physically dependent on a substance suddenly stops or significantly reduces their intake. The specific symptoms and their severity vary widely depending on the type of drug, the duration and intensity of use, and individual physiological factors. Common physical symptoms can include nausea, vomiting, muscle aches, tremors, sweating, fever, and seizures, which can be life-threatening in some cases. Psychologically, individuals may experience intense cravings, anxiety, depression, irritability, insomnia, and even hallucinations or psychosis. These symptoms are the body's attempt to re-establish equilibrium after the drug's absence, often leading to extreme discomfort and a strong urge to resume drug use to alleviate the distress. Effective management of withdrawal syndrome is crucial for safe and successful detoxification, forming the initial step in the recovery process. Medically supervised detoxification, often conducted in a specialized facility, provides a safe environment where healthcare professionals can monitor vital signs, administer medications to alleviate symptoms, and prevent complications. Medications can help reduce the intensity of cravings, manage pain, control seizures, and stabilize mood. The goal is to make the withdrawal process as comfortable and safe as possible, minimizing the risk of relapse due to severe discomfort. Following detoxification, individuals are typically transitioned into longer-term treatment programs that address the psychological and behavioral aspects of addiction, building upon the foundation of a safely detoxified body. Risk factors for addiction, genetic and environmental. Addiction is a complex disease influenced by a confluence of genetic, environmental, and developmental factors, rather than a single cause. Genetic predisposition plays a significant role, with research indicating that individuals with a family history of addiction are at a higher risk. Specific genes can influence how a person's brain responds to drugs, affecting their vulnerability to developing dependence. However, genetics alone do not determine destiny. Environmental factors interact with genetic predispositions to either increase or decrease risk. Understanding one's genetic background can provide valuable insight, but should not be seen as an unchangeable fate. It merely highlights a potential vulnerability that can be managed through informed choices and protective measures. This interplay underscores the multifaceted nature of addiction development. Environmental factors encompass a broad range of influences, including early exposure to drugs, peer pressure, lack of parental supervision, and the presence of trauma or abuse. Growing up in a chaotic home environment or experiencing significant stress can increase vulnerability. Mental health conditions such as depression, anxiety, or PTSD also significantly elevate the risk of substance use disorders, as individuals may self-medicate to cope with their symptoms. Socioeconomic status, community norms, and the availability of drugs in one's environment further contribute to risk. Conversely, protective factors like strong family bonds, positive role models, academic achievement, and access to mental health services can mitigate these risks. Addressing these environmental factors is crucial for both prevention and effective treatment strategies. Impact on physical health. Systemic effects. Chronic drug addiction inflicts widespread and severe damage across nearly every organ system in the human body. The liver, responsible for metabolizing drugs, is particularly vulnerable, often developing conditions like hepatitis, cirrhosis, and liver failure, especially with alcohol and opioid abuse. The cardiovascular system suffers from increased heart rate, blood pressure, and risk of arrhythmias, leading to heart attacks. Strokes and endocarditis, common with stimulant and intravenous drug use. The respiratory system can be compromised by smoking substances, leading to chronic bronchitis, emphysema, and lung cancer, while opioid use can cause fatal respiratory depression. Kidney function can also decline, leading to renal failure due to direct toxicity or indirect effects like rhabdomyolysis. These systemic effects underscore the profound physical toll that addiction takes on an individual's health, often leading to irreversible damage and premature death. Beyond organ-specific damage, drug addiction significantly weakens the immune system, making individuals more susceptible to various infections, including pneumonia, tuberculosis, and skin infections. Intravenous drug use carries the additional risk of contracting blood-borne diseases such as HIV and hepatitis B and C due to shared needles. Malnutrition is also common, as drug use often disrupts appetite and nutrient absorption, further compromising physical health. Dental problems, skin abscesses, and neurological damage like cognitive impairments or nerve damage are also prevalent. The cumulative effect of these physical health issues severely diminishes quality of life and complicates the recovery process. Addressing these medical complications is an integral part of comprehensive addiction treatment, requiring coordinated care between addiction specialists and other medical professionals. Impact on mental health. Co-occurring disorders. The relationship between drug addiction and mental health disorders is profoundly intertwined. Often referred to as co-occurring disorders or dual diagnosis. Substance use disorders frequently coexist with mental health conditions such as depression, anxiety disorders, bipolar disorder, schizophrenia, and post-traumatic stress disorder, PTSD. This relationship is often bidirectional. Mental health issues can increase the risk of substance abuse, as individuals may use drugs or alcohol to self-medicate and cope with their symptoms. Conversely, substance abuse can exacerbate existing mental health conditions, trigger the onset of new ones, or make symptoms more severe and difficult to manage. For example, chronic cannabis use can worsen anxiety, while stimulant abuse can induce paranoia and psychosis. The presence of both conditions complicates diagnosis and treatment. requiring a specialized and integrated approach. Individuals with co-occurring disorders face unique challenges, including higher rates of homelessness, incarceration, and medical complications. They often experience more severe symptoms, greater functional impairment, and a higher risk of relapse compared to those with only one disorder. Traditional treatment approaches that address only one condition in isolation are often ineffective. Therefore, integrated treatment, which simultaneously addresses both the substance use disorder and the mental health condition, is considered the gold standard. This approach ensures that care is coordinated, comprehensive, and tailored to the individual's complex needs, leading to better long-term outcomes and improved quality of life. Holistic care acknowledges the intricate connection between mind and body in the recovery journey. Social and economic consequences, broader effects. Drug addiction extends its destructive reach far beyond the individual, creating profound social and economic consequences for families, communities, and society at large. Within families, addiction often leads to strained relationships, breakdown of trust, domestic conflict, and even child neglect or abuse. The emotional toll on loved ones is immense, as they grapple with feelings of helplessness, anger, and grief. Socially, individuals with addiction may experience isolation, loss of friendships, and stigmatization, making reintegration into society incredibly challenging. They may lose their jobs, housing, and educational opportunities, leading to a downward spiral that further entrenches their substance use. The erosion of social networks and community ties can leave individuals feeling utterly alone and without support, severely hindering their path to recovery. Economically, the burden of drug addiction is staggering, encompassing direct costs such as healthcare expenses for treatment and emergency services, as well as indirect costs like lost productivity due to unemployment, absenteeism, and premature mortality. The criminal justice system also incurs significant costs related to arrests, trials, and incarceration for drug-related offenses. Communities face increased crime rates, public safety concerns, and reduced economic vitality. Furthermore, the intergenerational impact of addiction means that children growing up in affected households are more likely to experience poverty, trauma, and their own struggles with substance abuse. Addressing these broader social and economic consequences requires comprehensive public health initiatives, prevention programs, and accessible treatment options to foster healthier and more resilient communities. Recognizing the problem, signs, and self-assessment. Recognizing the signs of drug addiction, both in oneself and in others, is the critical first step towards seeking help and initiating recovery. Behavioral changes are often prominent indicators, including increased secretiveness, sudden mood swings, neglecting responsibilities at work, school, or home, and a noticeable decline in personal hygiene. Individuals may also withdraw from social activities they once enjoyed, prioritize drug use over all else, and exhibit unusual financial problems. Physical signs can include changes in appearance, dilated or constricted pupils, slurred speech, or unexplained weight loss or gain. It is important to look for patterns of behavior rather than isolated incidents, as addiction manifests as a persistent, compulsive drive despite negative consequences. Early recognition can significantly improve treatment outcomes. Self-assessment plays a vital role for individuals to honestly evaluate their own relationship with substances. This involves reflecting on questions such as, do I use more than I intended? Have I tried to cut down or stop but couldn't? Does my drug use interfere with my daily life or relationships? Do I experience cravings? Do I continue to use despite knowing it's causing harm? Answering these questions truthfully can help an individual acknowledge the severity of their substance use. While self-assessment is a powerful tool, it should ideally be followed by a professional evaluation from a healthcare provider or addiction specialist. This professional assessment can provide an accurate diagnosis and recommend appropriate next steps, ensuring a tailored and effective path to recovery. The decision to seek help, motivation, and readiness. The decision to seek help for drug addiction is a monumental step, often requiring immense courage and a significant internal shift. Motivation is a critical driver in this process, as individuals must genuinely desire change for treatment to be effective. This motivation can stem from various sources, including negative consequences of drug use, pressure from loved ones, legal mandates, or a sudden moment of clarity. However, external pressures alone are often insufficient. Intrinsic motivation, a deep-seated personal desire to change, is key to sustained recovery. Readiness for change is not a linear process. Individuals may cycle through stages of pre-contemplation, contemplation, preparation, action, and maintenance. Understanding these stages allows for tailored support that meets the individual where they are in their journey, fostering that internal drive for recovery. Building and sustaining motivation involves identifying personal values and goals that are incompatible with continued substance use. This might include reconnecting with family, pursuing a career, improving health, or finding a sense of purpose. Therapists and counselors often utilize motivational interviewing techniques to help individuals explore their ambivalence about change, strengthen their commitment, and develop the sense of self-efficacy. Setting small, achievable goals can build momentum and confidence, reinforcing the belief that recovery is possible. The journey to recovery is deeply personal, and the decision to seek help marks the beginning of a transformative process. It is a testament to an individual's resilience and their capacity for growth, paving the way for a healthier, more fulfilling future. Intervention strategies, guiding loved ones when a loved one is struggling with drug addiction. Intervention strategies can be a crucial step in guiding them towards treatment. An intervention is a carefully planned process, often involving family, friends, and sometimes a professional interventionist, designed to confront the individual about their addiction and encourage them to seek help. The goal is to present the individual with a united front of concern and support, clearly outlining the negative impact of their substance use and offering a clear path to recovery. It is vital that interventions are conducted with compassion and without judgment, focusing on love and concern rather than blame. The process typically involves family members sharing specific examples of how the addiction has affected them, expressing their love, and presenting a prearranged treatment plan. This structured approach helps to break through denial and motivate the individual to accept help. There are various types of interventions, ranging from informal one-on-one conversations to highly structured, professionally facilitated meetings. A professional interventionist can provide invaluable guidance, helping families plan the intervention, anticipate potential reactions, and navigate difficult conversations. They ensure the process remains focused, constructive, and safe for everyone involved. Key elements of the successful intervention include thorough preparation, clear communication of consequences if treatment is refused, example, setting boundaries, and immediate access to a treatment facility once the individual agrees to seek help. The ultimate aim is to create a loving but firm environment where the individual feels supported to make the life-changing decision to enter recovery. It is a powerful act of love that can save a life, offering a bridge from addiction to healing. Detoxification process. Medical supervision detoxification, or detox, is the initial and often critical phase of addiction treatment, focusing on safely managing the acute physical symptoms of withdrawal. This process involves clearing the body of addictive substances while minimizing discomfort and preventing potentially dangerous complications. For many substances, especially alcohol, benzodiazepines, and opioids, withdrawal can be severe and even life-threatening without medical intervention. Symptoms can range from intense cravings, nausea, vomiting, and muscle aches, to seizures, hallucinations, and delirium tremens. Medical supervision during detox is paramount to ensure the individual's safety and comfort. Healthcare professionals can administer medications to alleviate withdrawal symptoms, monitor vital signs, and address any emerging medical issues. This controlled environment significantly reduces the risk of relapse during the most vulnerable period of physical dependence. The duration and specific protocols of detoxification vary depending on the substance used, the severity of dependence, and the individual's overall health. A typical detox program might last from a few days to several weeks. Medications commonly used include benzodiazepines for alcohol withdrawal, buprenorphine or methadone for opioid withdrawal, and anti-nausea drugs or muscle relaxants for general symptom management. Beyond physical care, detox facilities also provide emotional support and a stable environment, preparing individuals for the next stages of recovery. It is important to remember that detox alone is not a cure for addiction. It is merely the first step. Following successful detoxification, individuals must transition into comprehensive treatment programs that address the underlying psychological, social, and behavioral aspects of their substance use disorder to achieve long-term sobriety. This foundational step sets the stage for deeper healing. Behavioral therapies, CBT and DBT approaches. Behavioral therapies are cornerstones of effective addiction treatment, helping individuals identify and change the thought patterns and behaviors that contribute to substance use. Cognitive behavioral therapy, CBT, is one of the most widely used approaches, focusing on the idea that learned behaviors play a significant role in addiction. CBT helps individuals recognize high-risk situations, challenge distorted thinking, and develop healthier coping mechanisms. For example, a person might learn to identify triggers that lead to cravings and then practice alternative responses, such as calling a sponsor or engaging in a distracting activity. The therapy also equips individuals with problem-solving skills and strategies for managing stress without resorting to drugs. Through structured exercises and homework, CBT empowers individuals to take an active role in their recovery, fostering self-awareness and self-control. Dialectical behavior therapy, DBT, originally developed for individuals with borderline personality disorder, has also proven highly effective in treating substance use disorders, particularly for those with co-occurring mental health issues. DBT emphasizes emotional regulation, distress tolerance, interpersonal effectiveness, and mindfulness. It teaches individuals how to manage intense emotions without self-destructive behaviors, including substance use. For instance, clients learn to accept difficult feelings without judgment, mindfulness, and to cope with overwhelming urges without giving in, distress tolerance. DBT often incorporates both individual therapy and group skills training, providing a comprehensive framework for developing crucial life skills. Both CBT and DBT equip individuals with practical tools to navigate the challenges of recovery, promoting lasting behavioral change and emotional well-being. Medication-assisted treatment, MAT, pharmacological support. MAT is an evidence-based approach that combines behavioral therapies and counseling with medications to treat substance use disorders, particularly for opioid and alcohol addiction. MAT is highly effective in reducing cravings, preventing relapse, and improving patient survival rates. For opioid use disorder, medications like buprenorphine, naltrexone, and methadone help stabilize brain chemistry, block the euphoric effects of opioids, or reduce withdrawal symptoms. These medications are not simply substituting one drug for another. They work to normalize brain function, allowing individuals to focus on therapy and rebuilding their lives without the constant burden of cravings. MAT is recognized by major health organizations as the most effective treatment for opioid addiction, significantly improving long-term outcomes. It is a comprehensive approach that addresses both the physical and psychological aspects of dependence. For alcohol use disorder, medications such as naltrexone, acamprosate, and disulfiram can help reduce heavy drinking, decrease cravings, and maintain abstinence. Naltrexone works by blocking the pleasurable effects of alcohol, while acamprosate helps restore the brain's chemical balance disrupted by chronic alcohol use. Disulfiram, on the other hand, creates an unpleasant reaction when alcohol is consumed, acting as a deterrent. The decision to use MAT is made in consultation with a healthcare provider, considering the individual's specific needs, substance abuse, and medical history. MAT is most effective when integrated into a holistic treatment plan that includes counseling, support groups, and other therapeutic interventions. It provides a crucial layer of support, helping individuals achieve and sustain recovery by managing the powerful biological components of addiction. Individual counseling, personalized support. Individual counseling is a cornerstone of addiction treatment, offering a confidential and personalized space for individuals to explore the underlying causes of their substance use disorder. In these one-on-one sessions, clients work closely with a trained therapist to identify triggers, develop coping strategies, and address co-occurring mental health issues. A therapist provides a non-judgmental environment where individuals can openly discuss their struggles, fears, and goals without reservation. This personalized attention allows for a deeper dive into specific challenges and past traumas that may contribute to addiction. Unlike group settings, individual counseling focuses solely on the client's unique needs, ensuring that treatment is tailored to their personal journey. It fosters a strong therapeutic alliance, which is crucial for effective treatment outcomes. Through individual counseling, clients gain self-awareness and insight into their behavioral patterns, thought processes, and emotional responses. Therapists utilize various techniques, including motivational interviewing, cognitive restructuring, and trauma-informed care, to help clients develop healthier ways of thinking and behaving. The process empowers individuals to set realistic recovery goals, build self-esteem, and cultivate a sense of agency over their lives. It also provides a safe space to process emotions, learn stress management techniques, and practice new communication skills. This personalized support is invaluable for navigating the complexities of recovery, helping individuals build a solid foundation for long-term sobriety and overall well-being. The consistent guidance from a dedicated professional can make a profound difference in an individual's ability to sustain recovery. Group therapy and support groups. Peer connection. Group therapy and peer support groups, such as Alcoholics Anonymous, AA, and Narcotics Anonymous, NA, are invaluable components of addiction recovery, offering a powerful sense of community and shared experience. In group therapy, a licensed therapist facilitates discussions among a small group of individuals who are all working towards sobriety. This setting allows participants to share their struggles, successes, and insights in a safe, confidential environment. The benefits include reducing feelings of isolation, receiving empathy and constructive feedback from peers, and learning new coping strategies by observing others. Group members often find solace in realizing they are not alone in their battle, fostering a sense of belonging and mutual understanding. This collective healing process strengthens individual resolve and provides diverse perspectives on recovery challenges. Support groups like AA and NA, while not therapy in the traditional sense, provide a structured framework for peer support based on the 12-step philosophy. These groups are led by peers in recovery and offer a powerful network of individuals who understand the unique challenges of addiction. Participants gain accountability, sponsorship, and a sense of purpose through helping others. The emphasis on anonymity creates a safe space for open sharing, fostering honesty and vulnerability. Both group therapy and support groups offer a vital social component to recovery, counteracting the isolation often associated with addiction. They provide ongoing encouragement, practical advice, and a sense of hope, reinforcing the commitment to a sober lifestyle. The connection with others who truly understand is a profound source of strength and resilience. Building a strong support system, family and friends. A robust support system comprising family, friends, and other trusted individuals is absolutely crucial for sustained recovery from drug addiction. These relationships provide emotional support, encouragement, and practical assistance, acting as a buffer against stress and relapse triggers. Family members can offer a stable home environment, help with daily tasks, and provide a sense of belonging that counteracts the isolation often experienced during addiction. Friends who are committed to the individual's sobriety can offer positive peer influence and engage in healthy activities. It is important for individuals in recovery to identify and cultivate relationships with people who genuinely support their journey and avoid those who might enable or encourage substance use. Open communication and honesty are foundational to building and maintaining these vital connections, fostering an environment of trust and mutual respect. Building a strong support system also involves setting healthy boundaries and learning to communicate needs effectively. Family therapy can be particularly beneficial, helping to heal past wounds, improve communication patterns, and educate loved ones about addiction and the recovery process. This therapy can address codependency, enabling behaviors, and other dysfunctional dynamics that may have developed during active addiction. For friends, it means clearly articulating expectations for a sober lifestyle and seeking out new social circles if necessary. A strong support system provides accountability, celebrating milestones, and offering comfort during setbacks. It reminds individuals that they are not alone and that their recovery is valued. This network of care is a powerful resource, empowering individuals to navigate challenges and maintain their commitment to a life free from addiction. Developing coping mechanisms, stress and triggers. Developing effective coping mechanisms is a fundamental skill for individuals in recovery, enabling them to manage stress and navigate triggers without resorting to substance use. Stress is a pervasive factor that can significantly increase the risk of relapse, as individuals often used drugs to self-medicate feelings of anxiety, overwhelm, or sadness. Identifying personal stressors and learning healthy ways to respond to them is crucial. This includes practicing mindfulness, engaging in regular physical exercise, pursuing creative outlets, and utilizing relaxation techniques such as deep breathing or meditation. These strategies help regulate emotions, reduce physiological arousal, and provide constructive alternatives to substance abuse. Building a repertoire of diverse coping skills ensures that individuals have multiple tools at their disposal when faced with life's inevitable challenges, fostering resilience and self-efficacy. Triggers are specific cues, people, places, things, or emotional states that can provoke intense cravings and a strong urge to use drugs. Identifying and understanding personal triggers is a vital step in relapse prevention. Once identified, individuals can develop proactive strategies to either avoid high-risk situations or to cope effectively when avoidance is not possible. This might involve changing social circles, avoiding specific locations, or developing a plan for managing difficult emotions. For example, if stress at work is a trigger, an individual might learn to delegate tasks, take regular breaks, or practice assertive communication. Learning to recognize the early warning signs of a craving and implementing a pre-planned coping strategy can make a significant difference in maintaining sobriety. The ability to manage both internal and external triggers is a hallmark of strong, sustained recovery. Relapse prevention planning, strategies for sustained recovery. Relapse prevention planning is an essential component of long-term recovery, acknowledging that relapse is a common, though not inevitable, part of the journey for many individuals. A comprehensive plan involves identifying potential relapse triggers, developing specific coping strategies, and establishing a robust support network. It is crucial to understand that relapse is not a failure, but an opportunity to learn and adjust one's recovery strategies. The plan should include recognizing early warning signs, such as increased stress, changes in mood, or thoughts about using. Having a clear, actionable plan in place empowers individuals to respond effectively to high-risk situations rather than being caught off guard. This proactive approach helps to build resilience and reinforces the commitment to sobriety, transforming potential setbacks into learning experiences. Effective planning provides a roadmap for navigating the complexities of sustained recovery. Key strategies in relapse prevention include developing a strong support system, practicing healthy coping mechanisms, and engaging in ongoing therapy or support groups. Individuals should have a list of emergency contacts, including their sponsor, therapist, and trusted loved ones, to reach out to during moments of intense craving or distress. Creating a daily routine that incorporates self-care activities, hobbies, and meaningful work can also reduce the likelihood of relapse. Learning from past relapses, if they have occurred, is also vital. Analyzing what went wrong and what could have been done differently provides valuable insights for future prevention. A well-structured relapse prevention plan is a dynamic document that should be regularly reviewed and updated as individuals progress in their recovery, adapting to new challenges and evolving personal growth. It is a testament to the ongoing commitment to a sober life. Healthy lifestyle integration: nutrition, exercise, sleep. Integrating a healthy lifestyle is fundamental to supporting long-term recovery from drug addiction, as it profoundly impacts both physical and mental well-being. Balanced nutrition plays a crucial role in repairing the body from the damage caused by substance abuse and stabilizing mood. A diet rich in whole foods, lean proteins, fruits, and vegetables can restore essential nutrients, improve energy levels, and reduce cravings. Many individuals in active addiction neglect their nutritional needs, leading to deficiencies that can exacerbate mental health symptoms and hinder recovery. Learning to prepare healthy meals and making conscious dietary choices empowers individuals to take control of their physical health, fostering a sense of self-care and discipline that extends to other areas of their lives. This holistic approach recognizes the interconnectedness of physical health and mental resilience. Regular physical exercise is another powerful tool in recovery, offering numerous benefits. It helps reduce stress, anxiety, and depression, which are common triggers for relapse, by releasing endorphins and improving mood. Exercise also enhances sleep quality, boosts self-esteem, and provides a healthy outlet for pent-up energy or frustration. Whether it's walking, jogging, yoga, or team sports, finding an activity that is enjoyable and sustainable is key. Adequate sleep is equally vital, as sleep disturbances are common during and after addiction, often contributing to irritability and cravings. Establishing a consistent sleep schedule, creating a relaxing bedtime routine, and optimizing the sleep environment can significantly improve sleep quality. Prioritizing nutrition, exercise, and sleep creates a strong foundation for physical and mental health, making the recovery journey more manageable and sustainable. Life skills development: practical tools for independence. Developing essential life skills is a critical aspect of recovery, empowering individuals to navigate daily challenges and build an independent, fulfilling life without relying on substances. Addiction often disrupts the development or maintenance of these practical skills, leaving individuals ill-equipped for the responsibilities of adulthood. Key areas include financial management, such as budgeting, saving, and managing debt, which are crucial for stability and reducing stress. Employment skills, including resume writing, job searching, interview techniques, and maintaining a job, are vital for economic independence and a sense of purpose. Learning effective communication and interpersonal skills helps individuals build healthy relationships, resolve conflicts, and advocate for themselves. These practical tools provide a solid foundation for rebuilding a life in recovery, fostering self-sufficiency and confidence. They enable individuals to handle life's demands constructively, reducing the likelihood of turning back to drugs. Addressing dual diagnosis, integrated treatment. Addressing dual diagnosis, the co-occurrence of a substance use disorder and a mental health condition, requires an integrated treatment approach that simultaneously treats both conditions. Historically, these conditions were often treated in separate systems, leading to fragmented care and poorer outcomes. However, research now overwhelmingly supports the effectiveness of integrated treatment, which recognizes that these disorders are deeply intertwined and influence each other. Attempting to treat one without addressing the other is often ineffective, as symptoms of one condition can trigger or exacerbate the other. For instance, untreated anxiety can lead to relapse, while substance abuse can worsen symptoms of depression. Integrated treatment ensures that care is coordinated, comprehensive, and tailored to the individual's complex needs, leading to more stable and lasting recovery. It acknowledges the holistic nature of healing, where mind and body are treated as one. Integrated treatment typically involves a multidisciplinary team of professionals, including addiction specialists, psychiatrists, psychologists, and social workers, who collaborate to develop a unified treatment plan. This plan addresses both disorders concurrently, using a combination of behavioral therapies, medication management, and support services. For example, an individual might receive medication for depression while simultaneously participating in CBT for their substance use disorder. The goal is to provide consistent, continuous care that helps individuals manage symptoms of both conditions, develop healthy coping skills, and improve overall functioning. This approach leads to better engagement in treatment, reduced hospitalizations, decreased substance use, and improved quality of life. By treating the whole person, integrated care offers the most promising path to recovery for individuals with dual diagnosis, fostering resilience and long-term well-being. Long-term recovery maintenance, ongoing support. Long-term recovery from drug addiction is a continuous journey that requires ongoing commitment, vigilance, and a robust system of support. It is not a destination, but a process of sustained growth and adaptation. After completing initial treatment phases like detox and intensive therapy, individuals transition into maintenance, where the focus shifts to preventing relapse and building a fulfilling life. This often involves continued engagement in various forms of aftercare, such as regular individual counseling, participation in support groups like AA or NA, and ongoing medical management, especially for those on MAT. The goal is to reinforce healthy coping skills, address new life challenges as they arise, and maintain accountability. Recognizing that recovery is a marathon, not a sprint, helps individuals prepare for the long haul and understand the importance of consistent effort. This phase is about solidifying the gains made in early recovery and building a resilient, sober lifestyle. Effective long-term recovery maintenance also involves proactive self-care and a commitment to personal growth. Regular self-assessment helps individuals monitor their emotional state, identify potential triggers, and adjust their recovery strategies as needed. Developing new hobbies, pursuing educational or career goals, and engaging in meaningful community activities can provide a sense of purpose and fulfillment that strengthens sobriety. Building a strong sober support network, including a sponsor or trusted mentors, offers invaluable guidance and encouragement. It is also crucial to have a relapse prevention plan in place, which is regularly reviewed and updated. Embracing a lifestyle that prioritizes physical health, mental well-being, and positive relationships creates a strong foundation for sustained recovery. The journey of long-term recovery is a testament to an individual's strength and dedication, leading to a life of freedom and renewed purpose. Reducing stigma and advocacy. Community role. Reducing the pervasive stigma associated with drug addiction is a critical step towards fostering a more compassionate and effective approach to recovery. Stigma, often fueled by misconceptions and moral judgments, creates significant barriers to individuals seeking help, leading to shame, isolation, and reluctance to engage in treatment. It perpetuates the idea that addiction is a personal failing rather than a chronic medical condition. Education is key to challenging these harmful stereotypes, promoting understanding that addiction alters brain chemistry and is treatable. By reframing addiction as a public health issue, communities can shift from punitive responses to supportive, health-oriented interventions. Advocating for policies that prioritize treatment access, harm reduction, and mental health services is essential. Every individual has a role to play in fostering an environment where those struggling with addiction feel safe and encouraged to seek the help they need, without fear of judgment or discrimination. Advocacy efforts extend to promoting public awareness campaigns, sharing personal stories of recovery, and supporting organizations dedicated to addiction research and treatment. By speaking out against discriminatory language and practices, individuals and communities can help dismantle the systemic barriers that prevent people from accessing care. Supporting harm reduction initiatives, which aim to minimize the negative health and social consequences of drug use, is also a vital aspect of advocacy. These initiatives, such as syringe exchange programs and overdose prevention, acknowledge the reality of drug use while working to save lives and connect individuals to treatment. Ultimately, a community that embraces empathy, understanding, and proactive support for individuals in recovery is a stronger, healthier community for everyone. Reducing stigma is not just about helping individuals. It's about transforming societal attitudes and creating a more inclusive and supportive world. Finding purpose and meaning, personal growth in recovery. Recovery from drug addiction is not merely about abstaining from substances. It is fundamentally about rebuilding a life filled with purpose, meaning, and personal growth. As individuals progress in their sobriety, the focus shifts from simply avoiding drugs to actively creating a fulfilling and meaningful existence. This involves exploring new interests, rediscovering old passions, and setting new goals that align with a sober lifestyle. Engaging in activities that bring joy, a sense of accomplishment, and connection to others can fill the void that drugs once occupied. This might include pursuing education, developing new career skills, volunteering, or dedicating time to creative arts. Finding purpose provides a powerful intrinsic motivation for maintaining sobriety, offering a compelling reason to stay clean beyond just avoiding negative consequences. It transforms recovery from a struggle into a journey of self-discovery and empowerment. Personal growth in recovery encompasses developing a stronger sense of self, improving relationships, and contributing positively to the community. It involves cultivating self-compassion, resilience, and a deeper understanding of one's values. Many individuals find spiritual growth, whether through organized religion or a personal connection to something greater than themselves, to be a profound source of meaning. The challenges faced during addiction and recovery often lead to a unique perspective and a heightened appreciation for life. By embracing these opportunities for growth, individuals can move beyond their past struggles and forge a future rich with purpose and connection. This transformative process allows individuals to not only beat drug addiction, but to truly thrive, becoming stronger, wiser, and more compassionate versions of themselves, inspiring others on their own paths to healing.